is back, which is terrifying if you're a woman, and I have some horrifying data to share with you. During New York Fashion Week, which just happened in 2025, there were roughly 3,640 looks on the runways, and I want you to try and guess how many of those models were plus size. Because the answer is 23. But that's okay, right? Because there's London Fashion Week, which is notorious for being the most plus size inclusive. Out of 1,600 looks, there were 26 plus size models. But let's put that into context. At New York Fashion Week last season in September 2024, there were 46 plus size models. In other words, representation for that incredibly common body type has been cut in half. In London, where I live, we went down from 80 to 26, which is a 68% drop. Fat shaming is back, extreme misogyny is back, democracy is backsliding, and women's rights are regressing. And we need to be very, very careful.
I'm scrolling on my feed, I'm hearing prepare yourself for skinny tea, prepare yourself for thigh gap. Me? Impossible. Do you remember how hard that was? That was the trenches. That was oppression. That was bondage. The amount of self-love it took to get here. You think I'm getting involved in that? I'm not involved. I'm not a monk. I've already heard Slim thick. Quit your cute ass. I got a big fat anthems have already been released. The self-love has already been deployed. Like, I'm not going back there. I just want to enjoy myself. Also, body positivity is learned. I'm not unlearning it now. Why?
If you're noticing right now, skinny is back in. So I'm going to let you on a little Hollywood secret that nobody's telling you. When I say skinny is back in, I am talking about people that were embracing their curves for a while and kind of making the thick girl come back and saying, oh, now it's better to have, that was a Hollywood trend, I feel like, over the last 5 years. But now everybody's trying to get dangerously thin again.
People saying that BBLs is retired is kind of offensive to the women that were always naturally built like this. And then y'all went and got bodies built like us, and now we're out of style. I just think that's so crazy and disrespectful.
I can't be the only one who has been seeing all these creators online saying, don't get fat, the worst thing you can be is fat. Don't be fat. If you're skinny, don't get, like, everything is like, don't get fat. And I know that skinniness serves as social currency in the societies we live in, but god damn, we get it. And take this from me as a personal trainer who deals with people who want to reach their fitness goals, a lot of the time being weight loss. I have no problem with you wanting to pursue a healthier lifestyle, drop a few pounds, want to fit into a specific dress. But telling people that the worst thing they can be in this society is fat is feeding into the fat phobic problem. Like, we get it. Being fat is not a good thing in this society. People hate fat people. It is what it is. But, like, shouldn't we be trying to dismantle that instead of pushing everybody to take Ozempic?
But why is everybody so obsessed with being skinny? Because what I eat in a day to stay skinny and what I do to stay skinny, like, wouldn't exist if, like, everybody didn't desire to be skinny. Like, there's other body types and, like, body goals that, like, is not just skinny. Like, don't you want to be strong? Don't you want to look fit? Don't you want to look toned? Like, why is skinny just the go-to word, the go-to term to, like, describe your ideal body type and, like, describe what you want? Like, I want to be skinny. How about I want to be strong? How about I want to be fit? How about I want to be toned? How about I want to look like a badass bitch? Like, what is with the obsession of being skinny? Like, I just feel like wanting to be skinny is such a, I don't even know the word to describe it, but it's like there's so many other things that you could be that isn't just skinny. You know what I mean? I don't know.
And to the skinny type girly who said, you're not a dog, you shouldn't treat yourself. Woof, woof.
Can we please talk about skinny being back in? I feel like we're back in the early 2000s all over again. As someone who grew up very, very slim her entire life, I literally would be called Bony Tony, and all types of things, being made fun of my size because skinny wasn't something that was considered good, at least in the Black community, back when I was in middle and high school. Now, having my grown woman weight at 23 years old, it is very interesting because now being petite is in when I finally gained some weight. Now, granted, I know I am not considered plus size. I still wear a size small medium, but it's like everybody is now doing the running clubs, they're doing Pilates, they're just doing all of these different workouts that make sure it ensures that they have like this really small frame. And I just don't have that super stick skinny frame anymore. Like literally every day I'm on the scale, I'm watching what I'm eating, I try to work out as much as I can, but like I'm just like so stressed because I feel like I'm not seeing the results I want to see as quickly as I want to see them. Like before 18, I was obsessed with gaining weight. I couldn't wait to look like those video vixens and all that stuff. But then I like started like accepting my body. I was content with it. And now here I am like around 23, I would say all started like really this year. I've just been super self-conscious because like you always see the girls with really, really tiny frames that didn't have to do anything to like maintain their frame, or they're working out like crazy. And I never had to work out before. I was always like really, really slim. So it's just interesting to see the changes in your body. And I think just adjusting as a woman to having a grown woman body. I think it's also super important to remind myself and other women that our bodies literally are changing. Like our hips are spreading. We're not going to be like this, like we were at 18, 19, when we're in our early to mid 20s. It's going to change. So I don't know. I'm trying to adjust to that and not think too hard about it. But it is very annoying, like the constant thinking of how I want to look and how much I miss my 18, 19-year-old body. But I really am just trying to be kinder and more patient with myself. It's just always something. It's like the older you get, the more issues you have, I swear. Right now, my biggest goal is to just stop obsessing over weight loss or trying to get more slim, like get that more slimmer look, and to just focus on being healthy. But I do also think that it's good that we are getting more active as a generation or as a society, whichever, because being active is really important and it's a part of your health as well. Okay, here's the finished super simple makeup look. This is my everyday makeup. And yeah, just as a whole, I hope someone can relate to this and just is more patient with themselves and doesn't let that changing number on the scale affect their mental health. Bye, guys.
Everyone's always talking about Ozempic face, but this is the real Ozempic face. Do y'all see all of these pimples? I never had texture skin until I got on this medicine. In the sun, it's not that bad, but all of these black spots came from day 2 pimples. If you know, you know.
You can't be out here thinking you're going to live a Sheila E. glamorous life. GLP-1s is not a magic wand. It's not your fairy godmother, like you just going to take an injection and just pop a bag of Cheetos. You just going to be all up at Sonic like a hedgehog eating chili dogs and hamburgers. It don't work like that. It's still going to take real work to achieve your goals. You're still going to have to exercise. You're still going to have to eat right. You're still going to have to change your overall mindset. Cinderella didn't just wish her way to the ball. She had to get her some glass slippers, okay? And when she didn't follow the rules, she wasn't Cinderella no more. Don't overestimate your superpowers, okay? You may not be hungry, but you still have to eat. You still have to get you some protein. Because if you don't, it don't look too good for you. Nobody is winning when you faint in the cereal aisle. So make sure you take your vitamins, you get you some protein, and you stay hydrated. Don't treat it like, listen, don't treat it like a free pass to eat what you want. This ain't Monopoly. You're not going to pass go and go into McDonald's. Overloading on fried foods, greasy foods, a lot of sugar will be sending a SOS to your stomach. And I'm going to tell you, it's going to come out either out your mouth or out your rear end. Don't skip the exercise. I'm not saying you got to be in the gym doing high impact burpees or lifting weights, but you can do some movement. You can walk around the house. You can do a few jumping jacks. You can dance, but exercise. And don't ignore the side effects, okay? Don't ignore the side effects. If you are having major side effects, stop and go consult your doctor. Immense stomach pain, consistent vomiting, consistent diarrhea. We got to find out what's going on. Don't push through. Don't push through, sis. This is a tool, not your life partner. Use it wisely and do what you're supposed to do while you own it. This is your opportunity to change your life, okay? We're not trying to do good to keep old habits, okay?
Seen the viral videos where everyone wants to be on this stuff because they think there will be a class action lawsuit one day and they want to be around for the payout because it'll be better than any retirement savings they've come up with. I'm an award-winning nutritionist and I'm going to teach you why this stuff earned itself that reputation. In order for you to understand, really quickly, I have to teach you how it works. Ozempic is a GLP-1 receptor agonist. It's mimicking the action of the natural GLP-1 hormone in your body. And this hormone plays a crucial role in your appetite regulation. So GLP-1 actually is a thing that helps to keep you full. But the natural version of GLP only lasts a few minutes in the body, which is why you can eat a lot of food, feel really full, and then a few minutes later you could potentially eat some more if you wanted to. This stuff right here acts on the GLP-1 receptors in your brain. And instead of lasting only a few minutes, it lasts hours. Why people who are taking this A, can't eat very much, and B, feel full for a very long time after they've eaten a meal. Well, obviously, this helps them to eat less and to have less cravings because their brain believes that they are full and that they are satiated. Now, this stuff also slows down the rate at which food is actually leaving your stomach, and that's a big problem. The longer food sits in your digestive system, the more likely you are to be reabsorbing toxins throughout your system from that waste. Toxins are backing up in your colon and in your intestinal tract, and here is prime proof. If you were to book an appointment at a colonics clinic and they know that you're on this drug, they need to see you for 75 minutes instead of 45 minutes because of that extra backup. Toxic overload leads to systemic inflammation, the digestive system that is not functioning properly. This is from Ozempic's own website. The very first thing that you should know about taking this is that it may cause serious side effects, including possible thyroid tumors and cancer. They're very open about the fact that in studies with rodents, Ozempic and medications that work like Ozempic actually cause thyroid tumors, including thyroid cancer. And over here, we've also got some pretty serious side effects that, although they are not as extreme as cancer, they are still pretty serious. So inflammation of your pancreas, changes in your vision, low blood sugar, kidney problems, allergic reactions. Bottom of the list says gallbladder issues. So I want to be very clear that I am not bashing this medication and that this is absolutely a helpful tool for people who have really serious blood sugar issues like diabetes. But all this right here is why people think there will be a class action lawsuit against this company.
So Ozempic, if you wanna ditch 10 kilos in 2-3 weeks, get some of this. However, if you wanna put it back on 6 months later, even earlier, times 30 kilos, then go ahead. And also, if you want to, wreck your thyroid, take it. If you want to, decrease your testosterone, your muscle mass, basically screw up your body, go ahead, take it. Ozempic, pretty crazy. I can't believe people are opting to take this. A lot of people are injecting this to lose weight. Pretty insane. Stay away from.
If you're currently taking Ozempic, you need to stop. 1, there is no research on a person that is not diagnosed with type 2 diabetes, okay? There's literally zero research. They haven't done any trials on all the long-term side effects for someone that is not diagnosed with type 2 diabetes. But they did do trials for individuals with type 2 diabetes, and guess what? There are a lot of side effects that come with this drug. Behind my screen, and I'm going to show you because I'm going to talk about the few side effects that you cannot see. I'm going to put it right here. This is on Ozempic's website, but guess what? It's this really small link because I really don't want people to know that there's long-term side effects besides just, nausea and constipation. So starting off with number 1, and again, I'm going to put it here. There is a risk of thyroid C cell tumors. You can get tumors from this drug. Number 2, pancreatitis. Next one, diabetic retinopathy complications. Retinopathy is your eyes. So you're having complications with your sight, which can literally lead to blindness. Over here, right there, it says acute kidney injury. So you're literally killing your kidneys as well because you're not able to filter out everything that you're putting in your body, so your kidneys start to fail. So are you telling me you want to be on dialysis? Here again is gallbladder disease. Your gallbladder does not function because guess what? Again, your kidneys aren't working, so they aren't able to filtrate out everything in your body. So then your gallbladder has complications because it gets infected, and now you can't go to the restroom. And remember, the number 1 side effect that they even talk to you about is nausea and constipation. So your GI tract is already messed up anyways. I'm going to put it back up here, but guess what? It says, to reduce the risk of major adverse cardiovascular events, in parentheses, cardiovascular death. People. That is what I was talking about in my other video. You guys aren't having enough potassium in your bodies, so you're not able to contract your heart, so then you go into cardiac arrest. I cannot give you specific people because I'm not allowed to name drop names because that's a HIPAA law. But trust me, go do research. It's out there. You just have to wiggle and find it because no one wants to show you it because guess what? It's all about money. Money, money, money. They got you on a drug that you literally have to be on for the rest of your life. That's corrupt.
You will get these side effects on Ozempic, but they don't include stomach paralysis. Real Dr. Bay, board certified plastic surgeon, and this is my take. If you're online or on TikTok, you always hear about stomach paralysis because it sounds so scary, but that is actually an extraordinarily rare side effect that's due to delayed gastric emptying. Delayed gastric emptying, one of the ways these medications actually work to help you lose weight. Statistically speaking, you're not going to get stomach paralysis, also known as gastroparesis, from delayed gastric emptying. What you will get from the delayed gastric emptying is nausea, vomiting, constipation, diarrhea, burping, bloating, and abdominal pain. Hopefully not all at the same time. And if you're going through a provider to get these medications, not a direct consumer website, if you're going through a provider, you can reach out to them and they can help you with these very treatable, time-limited side effects that will eventually go away the longer you're on these medications. For those of you who are having nausea from these medications, reach out to your provider and ask them for Zofran. They can help you and you'll get over it really, really quickly.
Ozempic should not be allowed for weight loss. Mark my words. Put them in a time capsule and open it in 15 years. Ozempic has a remarkable weight loss, but what they didn't focus on is that when these people are losing weight, they are losing muscle mass at a way higher rate than they should. As you play this forward, especially in elder patients, when you lose that much muscle mass, you cannot gain it back without extreme measures. The chemistry behind how they're losing that weight is really a starvation weight loss. This is the kind of weight loss that will decrease their immune system, decrease their bone density, decrease their muscle mass, and decrease their longevity.
So you're curious if I've had any side effects from being on GLP-1 medications for about 2 years now, so let's talk about it. So the answer would be yes and no, but I guess it depends on what you're referring to as side effect because I feel like there are positive side effects and negative side effects. So let's start out with the negative side effects first. In my case, I say the only negative side effect from being on GLP-1 medications for the past 2 years is muscle loss. I'm going to 100% take responsibility for that. Didn't do any weight training, any heavy working out or anything like that throughout my entire journey. The most I did in the beginning was walking, and that really helped jumpstart my weight loss. Other than that, I didn't incorporate much. So now I'm starting to incorporate things like Pilates. I'm about to start running, and eventually I do want to start weight training. Can't tell you exactly how much muscle I've lost. Maybe I should do that and do a video on it. But I know I've had some muscle loss, so that would be my negative side effect. Again, 100% my fault. Positive side effects from being on these medications for almost 2 years, there's literally so many. One, my skin is drastically different. I'll try to insert a picture up here where you can see my seborrheic dermatitis was just absolutely out of control. In the beginning of taking these medications, I did break out a lot, but that calmed down eventually after being on it a little longer. So skin improvement, my PCOS has improved drastically. Insulin resistance has improved drastically. I'm no longer pre-diabetic. I no longer have high cholesterol. I have a better relationship with food. I don't overeat. So I feel like, are there side effects from being on this medication for 2 years? Absolutely. 100 more pros than there are cons for sure.
The downside of taking Ozempic. Now, this is just what I experienced, but I'm gonna come in hot and kind of gross. And it's the brown logs, they stink way worse than the normal average. You know, when you can't handle your own funk, yeah, that type of. I think it's because the point of the medicine is to empty out your digestive tract slower. So I guess it stays in your system a little bit longer and keeps you full as well. So by the time it gets out of you, whew, pewee. Another thing is I'm always thirsty. I don't know why I'm always drinking water. I'm guzzling water. I drink at least a gallon of water a day, but that helps as well with weight loss. And just make sure you drink that water, keep that water intake going. Another symptom, which is weird, is I find that I feel like my breath stinks. And I brush my teeth every day, twice a day sometimes, you know, and I don't never have, you see, I have pretty good teeth, not to brag, you know, I got good oral hygiene, but for some reason, breath be hot. Also, I can't drink coffee anymore. I tried the other day and I spit it out. I think it's because it helps with people who have that A word. And, you know, so if you are you're not going to be anymore. It's going to take all that away from you. Let me know some of the negative experience you've had with Ozempic. I know a lot of people have had nausea, some people have constipation, some people had diarrhea, but I haven't had any of those, thank goodness.